I think we'll go ahead and get started. We have some of our wonderful League of Women Voters of Greater Omaha folks who are going to kind of manage as we welcome more people into our conversation tonight. My name is Rachel Gibson, and I am the Vice President of Action for the League of Women Voters of Nebraska. And I'm so glad that you're here tonight to join us for what we're calling Ballot Palooza, because we have quite a few ballot initiatives coming up this general election on November 5th. So our conversation tonight is to help kind of cut through, kind of make it clear what is on your ballot and what different votes mean, so that you're able to really cast the vote you want to vote for the policy that you want to see enacted. So I would love questions, so feel free to throw them in the chat. I'll try to keep an eye. I know that my other league folks will help me and kind of flag me. You can also raise your hand, and then we'll have some dedicated time at the end. So with that, we will go ahead and get started. So first, for those of you who are unfamiliar, the League, we like to just kick it off with letting you know who we are. So we're a nonpartisan, nonprofit grassroots organization, and our focus is really advocating for voters' role in democracy. So that looks a couple different ways. We have two main areas, which are voter services, often what people think of, folks registering voters, educating voters, that type of thing. And then we also have our legislative advocacy side. And that's usually the area that I'm working in during our legislative session in Nebraska, following the bills that are coming out, working with our over 30 volunteers in these different groups to analyze bills, write position statements, things like that. So that is one piece of what we do. But for tonight, I am very much wearing the education hat only. So the League does have stances on some of the initiatives we're going to talk about. You can look those up on our website. I am just here to tell you what's on and what it means, and to help clear up the confusion. All right, and with the League, the other thing we like to highlight is that we are across the state. We have over 400 members, and we have 4 local leagues and then members at large. So if this is of interest to you and you're not a member, we would love to have you join us. Okay, so let's start by talking a little bit about where we're going tonight. We're going to start by talking about the ballot initiative process, because that's really important to understand some of the nuances of the things that are actually on folks' ballot this year. So the first thing that I want to talk about is how laws happen, how the rules happen in Nebraska. And there's kind of 2 ways that rules can be made in Nebraska. The first is through our state constitution. So this is the absolute highest level of the law. Nothing can be written in conflict with it. Usually, it's kind of a general guideline or concepts that then guide the creation of specific statutes, which we'll talk about in a second. So usually it's kind of this big idea piece, not necessarily getting into the weeds. It is changeable, but it's very difficult to change. And we have a couple constitutional amendments on this ballot, so this is important to understand this nuance. To change our Constitution requires a vote of the people. So our legislature can't change our Constitution without the people agreeing to that change. So that's one piece. The other piece is state statute. So this is what our legislature does every spring, is they make state statutes, make our laws. It's basically like the manifestation or interpretation of those constitutional concepts, or things that the Constitution doesn't touch on that we need rules around. So those are the type of things that are in our state statutes. Again, they can't be in conflict with the Constitution. These are written by our legislature and then signed into law by our governor. They are much easier to change. They get still difficult. I should be very clear if you've ever followed the legislature. Still hard, still a lift, but it can be things can be changed by our legislature. It doesn't require that vote of the people. So to put this all in context, the legislature really is the primary policy-making entity, but the people can propose constitutional amendments or statutes via the referendum process. So let's talk a little bit about that. We are one of the few states that allows folks to have a people-driven initiative or referendum process, which basically means that we as the people can say, we would like to vote on this directly. And we make good use of that here in Nebraska. There are initiatives which adds or changes a law or adjusts our constitution, amends our constitution. There's also referendum, which is about repealing a law that the legislature recently passed. So this is getting really in the weeds, but again, it relates this year because we have all of these on our ballots. So when we think about this petition process, we think of it kind of as three groups are involved in this. First of all, sponsors. So a group of people that get together, really passionate about an issue and say, we want to put this up to the people for a vote. It's usually a group of people. They will file with the Secretary of State, and then those folks are the ones who manage the distribution. They're the ones who coordinated all the people standing in parking lots taking your signatures. I know that some of you on this call were the people taking the signatures. So the sponsors really manage that piece of it. The circulators are the people in the parking lots taking the signatures. And they can be, in our state, they can be paid or unpaid, but they take those signatures. And then the signers are us. So must be a registered voter in Nebraska. That's the requirement to sign on. So for a petition to be successful, because you can't just, somebody can't just file with the Secretary of State and say, I'm Bob and I think everyone should wear blue shoes on Tuesday. We have to get others on board with that. So a successful petition to actually get on the ballot needs between 5 and 10% of registered voters in the state. There's some nuances here. We do not need to get into it, but it depends on if it's an initiative, a referendum, timeline. The takeaway point is we need at least a good chunk of Nebraskans to say, hey, we want to do this. The other piece is that we need at least 5% of registered voters in at least 38 of the 93 counties. So this really makes sure that we are legislating to the benefit of the entire state and not just a certain demographic. So that's initiatives and referendums in Nebraska. Again, this seems really in the weeds, but it does relate to what's on this year's ballot. I'm not going to go through this whole process in depth, but the thing to know is those first 3 steps are really where the people are involved. They're collecting signatures. And then at the 4th step, the verification process, they hand it off to the Secretary of State's office, who then goes through, make sure all those signatures are valid. They come up with the title and the language. It gets approved to be put on the ballot. And then we come in where we help with voter information and education. And then we have the election, and then the outcome is declared. And it's always that simple, and there's never any hiccups. That is the structure that is followed. If you've been following any of the initiatives this year, we've had some challenges and things like that. But ultimately, we've had 6 referendum/initiatives get on the ballot. I'll share these slides after, so I just include this so you can really get a sense of what this process looks like. When you're looking at ballot questions, so we talked about kind of the difference between constitutional, statute, how things even get to the people to vote. So now we're talking about, how do you consider these ballot questions? How do voters learn about them? First of all, understanding the question that's going to be asked and how it's going to be asked. So yes versus no, repeal versus retain, for or against, those can mean really different things. So understanding how the question is going to be asked. Understand what your vote will do. So think about it in terms of what it will change or enable people to do. And a good way to kind of think about that, in my opinion, is to really focus on the underlying issue. So that is, stepping away, maybe thinking about each of these topics, and before even looking at the ballot, saying, this is how I would like it to be. This is how I feel about this issue in our state. And then let's put that on top of what's on your ballot and figure out how to vote that matches that. So start with what you want it to be, as opposed to starting with the options. I think that's really helpful to kind of cut through things. Another really useful tool is to explore who sponsored or supported each side. Here are a couple different options. Open Secrets is a website that kind of tracks who funds what initiatives in our government. A lot of it is more of the federal level, but there is some information there. Nebraska has a disclosure website, which is so much information, a little hard to navigate. So that's when I really rely on those trustworthy news sources that kind of help say, here's who's behind these things. And I find that helpful for assessing ballot initiatives because it helps me understand the context. It's not necessarily saying, well, I shouldn't support this because whatever organization provided money. It's more saying, oh, okay, I think that kind of aligns with where I'm thinking. That's a group I usually kind of am in agreement with. So it helps kind of set that context. And I just shout out to the Nebraska Examiner. They do fantastic work. If you don't already follow them, they have a particular article from September that has a good summary of each and gets into some of those more nuanced details. Because today we're just talking about what they say. That Examiner article digs a little bit deeper. Oh, and utilize multiple sources of information. This is just good kind of fighting mis and disinformation. Anyway, see if you can find things in multiple places. There are a lot of texts going out. There are a lot of mailers and TV ads and things like that. Sometimes there's things raised in those that are really helpful to know, but always confirm with some other source so that you know that it is actually something that is true of whatever's being suggested. Okay, so we've talked about kind of the initiative process. We've talked about kind of how to think about it. And now we're going to move on to initiatives and referendum for this particular election. What's going to be on your ballot? I'm going to pause real quick just to see if anybody has any questions. Feel free to unmute yourself and ask or put it in the chat. If not, I will keep talking as my colleagues know. And then water, give everyone enough time. All right, cool. Let's just keep trucking along here. So what is going to be on the ballot, which you may already have, depending on if you do early voting or not. So initially, there were several proposed initiatives and referendum. This is the full list. After all that process of signature collection and verification, we ended up with just 6 actual items. Now, this year is kind of interesting because we have 6 individual items we're voting on, but we're really only talking about 4 topics. So that's also some of the clarity we want to provide here. So the way we're talking about them today is going to be, we've grouped them together so that we can talk about differences, but the way they're going to show up on your ballot is just a little bit different. So the 4 topics we're talking about are abortion, private school scholarships, paid sick leave, and medical cannabis. So let's just jump in and talk about, obviously, the easiest one to talk about, which is abortion. So the way we're going to talk about this is we're going to start with what is the current law, and then we'll talk about what each one, how it would change what happens in Nebraska. So current abortion law in Nebraska is that abortion is legal in Nebraska up until 12 weeks. After that point, there are some exceptions for medical emergency or pregnancies resulting from sexual assault or incest. So that is our current law. That's in statute. So keep that in mind. It's in statute. Our legislature passed that. So with our first ballot initiative, and this is the first one you're going to see on your ballot, 434, which is protect women and children. I'm not going to read you the official language. You can see it there. But what this does is it amends the Constitution to prohibit abortion after the first trimester, which is usually about 12 weeks, unless in the case of medical emergency or when the pregnancy resulted from sexual assault or incest. Now, that sounds very much like our current law, because it is very much like our current law. The difference is, and this is an important difference, is that right now, our law is in statute. This is going to enshrine it in our Constitution. And remember, it's a lot harder to change constitutional limits. So the way I think about it is statute is writing something in pencil, and it gets changed and edited by our legislature. Putting something in our Constitution puts it in Sharpie. We can mark through it, but it takes a lot more effort. So what this would be doing is essentially taking what's in law now and structuring it in our Constitution as a limit. The other piece that's important here is that the legislature can still pick up that pencil and write something more restrictive, fewer weeks under the 12, but the 12 is the limit. the legislature could not come in and increase that, because again, that's the constitutional limit piece. So important details of this one. So to dig in there, just to be very clear, a vote for prohibits abortion after the first trimester with these medical exceptions, and allows the legislature to enact additional regulations. So that's a vote for. A vote against keeps the current 12-week limit with the existing legislation or exceptions, and the legislature can continue to regulate either direction. So that's the first one. Let's talk about the second one. So the second abortion initiative is protect the right to abortion. And we're talking about it next to each other in this conversation, but it's actually going to show up last on your ballot. So this is the very last. They're bookending it. So this one, again, I'm not going to read through the whole official language, but you can see it there. This instead creates a constitutional right to abortion based on fetal viability. So whereas the previous one was restricting abortion at 12 weeks and you couldn't go beyond that, this is saying the red line is what's called fetal viability. That's much broader. It's also a little bit fuzzier around the edges. Just generally, most people think of around 23 weeks as sort of the cutoff. So your baseline is higher than the 12 weeks. But this also provides some language around health of the mother, other situations as determined by the practitioner and the patient. So this is getting at those things like you may have heard of fatal fetal anomalies. So that's the terrible situations in which a doctor says after that 23, 24 week, they've discovered something that the baby will not survive outside the womb. Then that gives the physician and the patient the ability to have that conversation and decide what they want to do. Whereas in the previous, you would go ahead and go carry that pregnancy. So that is a difference. This one is fuzzier. Good or bad, it just is. So to talk about what that looks like is a vote for constitutionally allows for abortion based on viability as determined by the patient and their healthcare provider. And it restricts the legislature from enacting additional regulations. So, in the last one, we talked about 12 weeks is kind of the ceiling, but they could lower that. In this one, because it's based on viability, the legislature couldn't write something that was like a 12-week ban because that is in conflict with the right based on viability, if that makes sense. So a vote against, again, just keeps the current 12-week limit with the existing exceptions. Now, before we jump into the next topic, I want to clarify something that's really kind of messy with this ballot initiative session. It is unusual to have two initiatives on the same topic that are in conflict, and these are innately in conflict with one another. With most cases, if you have a ballot initiative, you hit the 50% mark and one vote, and that passes. That's now in our Constitution. Because we have two of those, there's a variety of options. Neither can get the 50+1 threshold, and then the law just stays as it is in the pencil for the 12 weeks. One of them or the other could do the 50+1, and then obviously whichever made the 50+1 would be law. And then there's also the option that both of them could get 50+1 votes. And then what happens is the one that has the most yes votes becomes law. So this is where it gets a little sticky. And folks, that's why I say start with what do you want the law to be, and then figure out what makes sense. Because some voters might be walking in, and they're not in the weeds like, like I am, they have lives. And so they're thinking, I want to vote about abortion, and I've just heard a lot about this, and hey, both of these are talking about the Constitution, and so they must both be protecting the access to abortion, or the flip side, they both must be restricting abortion. That's not totally the case. So there's a very likely chance that you could vote yes on one and no on the other. People also might vote no on both. People could vote yes on both. I would love to talk through the logic of that one. I'm sure it exists, but Most people will be doing one or the other. You also have the option to not vote at all on these. I mean, I'm a democracy person, so I'm like, yes, vote, please vote. But you do have that option. You don't have to pick. Okay, I'm going to pause real quick. I don't want to, if people have some questions, I don't want to rush through this and forget them by the end. So any questions about the two abortion initiatives? Cool. I'll just keep going. At the end, we can also take some time to kind of, I'd love to answer questions about maybe things people have heard and kind of do some myth busting based on just the language. Yeah, Cindy, you and I are on the same wavelength. Cindy says she's seen many ads that are confusing or misleading. Yeah, and there is a lot of, there's a lot of complexity to this, which makes it difficult. There's also that in itself makes it difficult. There's also the potential that muddying the waters will make it harder to enact anything one way or the other. So there may be some benefit to different folks to making it a little bit more confusing. What I would say is, again, go back to that. Who's supporting the different initiatives? There's a really fantastic, I'm a little biased, but there's a fantastic group called Nebraska Alliance for Physician Advocacy, and they've done a podcast that is speaking with physicians about what this actually looks like. And it's a more in-depth conversation. So like something like that would be a wonderful way to really cut through the noise, because there are healthcare providers on both sides of this particular one. So that's where it's helpful to go back and look at, the official statements of different organizations and where they stand on stuff. Okay. Let's talk about private school scholarships. So the second topic you'll see, there's only one item on this, and it is private school scholarships. So again, let's talk about what the actual current law is. And we have to go a little bit farther than just the current law on this one because it is complicated. So the previous scholarship program that passed 2 legislative sessions ago was called the Opportunity Scholarship, and it was based on tax credits to donors. So it was kind of a way to maneuver public funds into private schools via donors and tax credits. There was a referendum on that, to get it on the ballot to vote. That passed and was slated to be on the ballot for 2024. And so in response in the legislature this spring, proponents of that effort passed a bill that repealed that scholarship program and in its place replaced it with just a straight up scholarship program. So just a direct $10 million in scholarships, no tax credits, just directly to scholarships. So that's where we're at right now. Right now, what is in law is a $10 million scholarship program that is built to grow to a larger part of money, but the first year it's 10 million. So that's where we start. That's where we're at right now. So what you'll see on your ballot is this is a referendum because we want to repeal something. We're not implementing something new. We're wanting to repeal something. And you'll see the language there. Again, the reason it's so complicated is because what this would do would repeal the portion of the bill that created that scholarship program, but leave in place the repeal of the previous program, if that makes sense. Because think about it, if they repealed that whole bill, then it would re-implement the first scholarship program. So this one is keeping that, the repeal of that, so that doesn't exist, and then also getting rid of the scholarship program. So description, really cutting through here. The 1402 provides state funds for K through 12 private school scholarships with that start amount at 10 million a year and increase from there. So if you vote to retain this, that means the takeaway message is that we will enact a state-run, publicly funded private school scholarship program. If you vote to repeal, repealing would be we have no scholarship program and we will not have the opportunity scholarship because it already existed. So a vote to retain basically means we're implementing public funds for private schools through scholarships. A vote to repeal means there are no programs that are providing dollars for private school from taxpayer funds. So again, super nuanced and detailed, but the takeaway is retain, we have a scholarship program, repeal, we do not have a scholarship program. Again, and that scholarship is state funds for private education. Somebody asked a question. Claudia asked, is there an ending date to the 10 million? Cindy very correctly said no. And actually, if you go back and look at the legislation, it is built to expand. And Cindy, you probably know what's the limit? Is it 100 million? I want to say it is set to grow. It won't just be 10 million each year. Okay. Gonna keep any questions on scholarship before we move to sick leave? I feel awful because I'm just talking. Okay, we'll just keep going. Cindy's unsure about that part. That's fine. How could you know everything, Cindy? You already know so much. Okay, shifting gears, we're going to talk about paid sick leave. So this is probably the ballot initiative that's kind of flown most under the radar. And again, we're going to start with kind of that current law. Current law, there are no Nebraska state laws that require private, meaning non-governmental, anything that's not like state government, employers to offer paid time off for sick leave or vacation leave. That's the law. Now, some employers do, but the law does not require it. So an added piece to this, because some people will say, well, what about that FMLA thing? FMLA is a federal program that entitles eligible employees to take unpaid family leave. So it's not paid leave. It is a certain amount of time for specific family medical reasons. So that's our current law. So what this paid sick leave initiative is, it's a longer one. It's got some details there. The biggest takeaway is that it will require Nebraska private, non-governmental, employers to allow employees to earn paid sick leave, a minimum number of those paid sick leave days. And you'll see there's a difference there between large employers and small employers. So 40 hours for employers with under 20 employees and 56 hours for employers with more than 20 employees. So again, this is not saying you automatically, day someone starts, have to give them 2 weeks vacation. That is not what this is. It is that they are able to earn sick leave as they work that then they can use as paid sick leave. So a vote for requires all employers to allow the employees to earn those sick days, paid sick days. And a vote against keeps the current situation where employers are not required to provide anything. Some do, but there's no requirement. And the nuances, the longer language is also hitting on no retaliation, documentation, kind of the things to actually make that work, to actually implement it. Mary's asking, does the government have to offer paid sick leave? If not, why isn't the government included in this? So our state government does offer paid sick leave, both federal and state. So that's why they're not included, because they already have rules around it. Great question. Great question. Other questions? Okay. Cool. Let's get to the last topic. So we're on our last two items, last topic, which is medical cannabis. Current law. In Nebraska, marijuana is classified as a Schedule I controlled substance, which means possession for any reason, medical or recreational, is illegal. And the penalties can range from an infraction all the way up to a felony conviction. So it's a pretty wide slew. That's the current law. Now there are two different items here. And the computer was trying to emphasize that point by skipping one of them. So the first one, 437, is the Medical Cannabis Patient Protection Act, or statute. And what this would do would allow qualified patients, and qualified meaning with a written recommendation from a healthcare practitioner, to buy, possess, or use small amounts of cannabis for medical purposes. it also has kind of an umbrella of a caretaker who's doing that too. It falls under that safety net, so they can possess it if they're assisting in helping that patient use. So that's what this would do, is it would allow for that medical piece of small amounts. A vote for is legalizing a small amount of medical cannabis. A vote against is keeping it where any use of cannabis, medical included, is illegal. Okay, so that seems fairly straightforward, right? So what's the second one about? The second one about is the medical cannabis regulation piece. So this creates the Nebraska Medical Cannabis Commission, that is the entity that regulates that. So the first one protects folks from being prosecuted if they're possessing or using this. The second one creates a system that creates the regulation for it. It puts some guardrails around the manufacture, distribution, delivery, and has recognized entities that fall under this medical marijuana piece. So it's not just the wild, wild west. So a vote for this legalizes and regulates the cannabis industry. So the first one is talking about the patient themselves. The second is talking about the industry, the regulations of the industry. So a vote for legalizes and regulates. A vote against, again, keeps medical cannabis, along with all other cannabis use, illegal. This one, you tend to see advocates either vote yes on both or vote no on both. I suppose that you could vote yes on one and no on the other. Again, that's kind of I'd be interested in the logic there. Maybe some people are okay with the regulation, but they want to regulate it before they use it. Maybe, I'm not sure. But that is an option. Again, you don't have to vote both yes, both no on either of these. Claudia's asking, does this require all doctors to approve of medical use? Oh, Claudia, what a question. I need to dig into that a little bit, and I'll follow up. I don't think it requires physicians to prescribe. I think that this is like any other, it would be treated as another tool for physicians who wanted to use that, that would be an option for them. So that's a good question. I'll check. I don't think one could go in and demand medical marijuana, just as you can't go in and demand opioids. So it's adding it as another substance like any other drug, although it is not regulated currently, hence the second initiative. Okay. Questions on medical marijuana? Okay, I just want to shout out a couple resources here, and then I'm going to take off my screen and we can chat if folks have questions. Again, I know many of you are already members of the league. We would love to have you if you are not. And then another great resource is our Vote 411, which puts out our voter guide, our nonpartisan voter guide. In Douglas County, we have all the races covered. And so we send out questions. I should not say that. One of our amazing volunteers, Jean Miller, sends out questions to all the candidates. They get the same questions. They send their answers back. We put them in, there's no spin. It's the words from the candidates, same questions. So that is a really, really useful tool to use as well.